Hospitals in mountain communities also being overwhelmed by the surge in COVID patients, many of them actually too small to have an ICU. And as NBC4's Tony Shin explains, some are having to transfer their patients hundreds of miles away.
These are pictures provided by Bear Valley Community Hospital in Big Bear Lake, where the emergency room has now been converted into a COVID-19 unit, and a small conference room has been turned into an emergency room for people suffering from non-COVID related emergencies. Portable units have also been brought on site to handle the overflow.
I've been, as a previous registered nurse myself, in this business for over 50 years. I have never seen it like this, even when I was in the military.
Hospital CEO John Friel says the recent surges in COVID-19 patients have overwhelmed his staff of about 200 people.
Our staff is getting worn out. We've brought temporary people in from around the country. We've been able to get some people locally who have decided to come back into the workforce.
The hospital only has 30 beds, and because of the increasing number of patients, temporary rooms are being set up in the hallways.
You have an 8-foot corridor, you put a 4-foot bed in there, and all of the privacy screening and IV poles and other activities. It's getting pretty congested.
Other mountain hospitals are also being overwhelmed, including Mountains Community Hospital in nearby Lake Arrowhead. It doesn't have an ICU, so like Bear Valley, it depends on bigger hospitals like Loma Linda University and Arrowhead Regional to transfer critically ill patients.
They're all backed up as well. We have had to transfer patients as far away as Reno and San Francisco just in the last week.
As hospitals continue to struggle with COVID-19 patients, Friel says most likely the worst is yet to come.
Now that Christmas and New Year's is over, we're expecting to have a surge upon a surge, probably by this weekend.
Tony Shin, NBC4 News.